afternoon, everybody. Ladies and gentlemen, our youth, thanks to Miss Lizette, Miss Emily, but especially thank you to Miss Renee. I don't know where she went to. I want you to know you are the reason we stand here and do what we do and why I stand on this podium. You are enough. All right. The challenge to presenting in any forum is ensuring that the correct message is conveyed to the audience you are trying to capture. And when you are passionate about said topic, and by you I really mean me, it becomes difficult to compress a lot of content into such a short time. So let's see how I manage. Remember two things, however. Since last time I presented, I still get socially anxious presenting, and I still prefer paper to technology. So I felt both a sense of belonging and connection to Miss Emily and Miss Renee when I came up here. Okay, so I would be remiss if I did not start by reintroducing Alex's Place to all of you. Through a joint partnership between the Alex Panton Foundation, the Ministry of Health and Wellness, the Mental Health Commission, the Health Services Authority, the population with the greatest mental health need was identified, and as a result of many years of hard work from these collaborators, just over 1 year ago, the doors to Alex's Place were officially opened. So where are we? We are located to the left after passing the atrium or the main entrance to the hospital, which many persons previously know to be the old general practice or GP unit. Beautifully renovated to make our youth feel a level of comfort in what can be a very harrowing experience for them. Opening hours are Monday to Friday, 10 a.m. to 6 p.m., excluding public holidays and weekends. Outside of these times, remember any emergency medical facility or 911. And the population we serve at this time remains our adolescents, aged 10 to 20 years, with acute, urgent, or emergency-related mental health conditions. By no means do we wish to exclude our even younger population from mental or behavioral health challenges. However, based on world data and local data, the population with the greatest need was identified. A triage system is in effect from point of entry, hence understand if we believe your adolescent requires more intense management, we will redirect them to either the urgent care or the accident and emergency departments or any other required service. Our team, however, does not believe in turning anyone away. We want to ensure that any child, adolescent, parent, guardian, or just someone who's concerned that walks into Alex's Place at some time, whatever, their element of need is met, even if that means simple education or listening to your concerns to assist as best as we can. Okay, missing a few important team members, as this was a very impromptu photo shoot. Not one of us was Instagram ready. Meet our little team, which has started to grow from when I first presented 1 year ago. These are a few of the friendly faces you can be greeted by on entering Alex's Place. A multidisciplinary team built with your kids in mind, from our front desk therapy assistant to our nursing team, our psychologists, community psychiatric nurses, social worker, occupational therapists, psychiatrists, even our applied behavioral analysts, and our security team. Each person plays a role in the care of your adolescent from point of entry to point of leaving. Now, we hope the value of this service extends not only to your children and hence your families, but also the greater population of Cayman, as statistics gathering is important in having local data to identify key trends in things like disorders presenting on island, morbidity, behaviors, societal challenges, and relating same to previous years and international statistics, and hence effecting change. There is a dearth of data, both locally and regionally. However, we can only grow from here. So we start with some international statistics, which explain why we consider mental wellness to be an important part of any health system's governance. World Health Organization, November 2021, saw that 14%, that is 1 in 7 of our adolescents aged 10 to 19 years, experienced a mental disorder in their lifetime. And this accounts for 13% of the global burden of disease. What the global burden of disease does is quantify the human potential that is lost in years due to poor health or early death. And we see that staggering statistic of suicide. 1 in 5 children will have an identifiable mental health condition annually, with depression, anxiety, and behavioral disorders leading the causes of illness and disability among adolescents. Here, disability could be regarded as adolescents with mental health conditions who become particularly vulnerable to social exclusion, discrimination, stigma, educational difficulties, risk-taking behaviors, physical illness, and human rights violations. And this is where I have to remind myself I can't expand anymore. Right? We have coffee coming up, so we'll just skip ahead. So the Cayman Islands hosted about 81,546 persons as per the 2022 census. And of that number, 6,990 were children aged 10 to 19 years. Further, Cayman Island mental health statistics showed that in 2022, 12,600 patients, adult and children, were seen with mental health concerns. That's about 15% of your population, with more anxiety disorder than depressive disorders being reported. And remember, mental health disorders are underreported. Of that, the largest increases in service utilization occurred among the younger age cohorts, and data of children across HSA, because that's what I had at the time, suggested that 20% of adolescents in Ireland sought services for mental health in 2021. And I specifically place juveniles and the conviction rates there because undiagnosed behavioral and conduct disorders lead to criminal behaviors. So, the likelihood of mental disorders trending upwards, especially after COVID, is expected. So let's see a little bit about what we got. We are seeing, as per international data, more females than males. And that's likely because females, we tend to talk more about our feelings, and we have better social support as a result of that. Hence, we go for services more readily. This is not good because it impacts our males. What we also saw in Alex's Place data so far is that we are already seeing a 0 to 9, obviously not 0, but 0 to 9 age group captured in this data. And already for the year, I've seen about 5 under 10 years of age come through the department. And you can see that. Risk assessments are done on our younger persons. And this is a trend. Not even looking at the numbers right now of persons who came into services or the amount of encounters they saw. I just want you all to see the steady climb in the clients accessing services. And these clients are our children. Whether there is due to less stigma, more awareness, or concerns with behaviors, I don't know, that requires more analysis. But we know we still expect to see this steady climb. So what is a snapshot of the diagnosis we've seen through Alex's Place? It's similar to World Data. World Data usually speaks to depressive disorders mostly, but ours is seeing the anxiety disorders more. And we're also seeing an increase in stuff. And when I say mood disorders at the top, it speaks to both depressive disorders and bipolar disorder. But there's also a significance of substance abuse. And what we were seeing is it's mostly nicotine with vaping, but there's also significant cannabis abuse that's coming. We saw less of the alcohol and the caffeine abuse that we see, or other substances. The problem is our toxicology screens, because we do screen for it. Our toxicology screens do not speak to stuff like the newer stuff on island, right? And of course, we do mandatory reporting. We do have to work closely at times with our safeguarding team, which is our MASH team, with the Department of Child and Family Services, with thanks. Again, these numbers may underrepresent the referrals done through Alex's Place because there is a level that goes out from the admissions units. So either the pediatric unit when we admit directly from the emergency room or the mental health unit. But we see suicidal behaviors as one of the safeguarding referrals, physical abuse, sexual abuse, and neglect. So, which brings me to the ABCs of the concept of building bridges. Let's start with the example of a multi-vehicular accident. Yourself as the passenger and Tim driving. That's our friend Tim driving. You start to call 911 and your friend drives off, saying, "What car crash are you talking about?" Each person's actions differed, and hence the consequences of each person's actions would also differ based on their acceptance or non-acceptance of the situation. So acceptance sets the groundwork for getting one's bearings, assessing the situation, and ultimately seeking support and solutions. Acceptance can be self-acceptance. I have a mental disorder, which is lifelong, requires medication. How do I manage same? The stigma against it. Do I have new limitations? But acceptance is also related to community acceptance, whether religious choices, differences in sexual identity, stigmatization of mental illness. Why do we shun diagnoses such as autism spectrum disorder, schizophrenia, bipolar disorder, but welcome or accept diagnoses such as migraines, asthma, type 1 diabetes? All are medical conditions. That is, not only does acceptance involve my acceptance, it involves your acceptance. In psychology, belonging is the subjective feeling of a deep connection with social groups, physical places, and individual and collective experiences. Our HR managers would tell us that there are 5 identified pillars needed to foster belonging in a workplace: welcomed, known, included, supported, connected to life within an organization. No difference when you think of our adolescents. In school, where differences are readily identified, or in the community. The difference between kinky hair or straight hair, white or black, rich or poor. Hence why you'll see some children when much younger interact well without judgment in kindergarten, but then clique in high school. Belonging looks different for some. An adolescent in a gang may feel that's their family, especially having a very trauma-filled home life. And this is why I put up Maslow's hierarchy of needs, as not only are basic needs important, for us to transcend, psychological needs also have to be met. And my next slide will speak not only to the importance of connection, but also another C, collaboration. But for this slide, I want you to think about something. The statistics after the COVID-19 pandemic lockdown showed a significant increase in social anxiety disorder due to that lack of human connection and human interaction. So collaboration may be one of the most important bridges that we build. Our network of care begins at the level of the home, hence why we see the patient and the family or the caregiver central to same, which means a child's acceptance of their mental illness and their mental health challenges starts with how family members respond to mental illness. Most of the time, unconsciously, we say things like this: your cousin Bill mad, your friend Jill crazy, they demon possessed, that's why they act that way. You're going to hell if you kill yourself. You're hearing voices, all of those different things. Hence, any child struggling with the experiences of hearing voices, their discovery of their sexuality, or even sexual abuse, it impacts how that child accesses care services. But it does not stop there. It extends outwards. I have already spoken on Alex's Place's role in the network, but I don't forget the rest of our support team, our HSA family, the dietitian who counsels through a disordered eating, the occupational therapist who works with them on building social skills, our pharmacist who spends time to speak to a nervous parent starting medications. Broader, I speak to the community, the volunteers who will be working with the kids' helpline moving forward, school personnel entrusted with our children's well-being, your spiritual advisors, medical and counseling services, both government and private run, Mental Health Commission, our children and mental health laws, the existence of strategic policy frameworks combined with effective oversight, coalition building, provision of appropriate regulations, incentives, and accountability. Our overall health systems governance, the processes, structures, and institutions that are in place to oversee and manage a country's healthcare system are important in building strong links in our children's mental wellness. I don't want to harp on the roadblocks which exist. Some of them are big enough, like there are not enough of us mental health professionals, worldwide or here. It is a crisis. However, a lot of them are, Beijing word, overcomeable. Difficulties with parent and family engagement and recognizing the need for interventions. As once not an overt physical sign or severe behavioral challenge, the belief is the child needs to change. Financial constraints, or even having an understanding workplace, which does not result in a loss of income when bringing a child for appointments, can result in a child defaulting from care. Improvement in collaborative response efforts, social support from community, layperson or professionals, lack of a designated child and adolescent residential facility, of course, I'm plugging for that, or exploring revisions to current child and mental health laws. But I prefer to end on the positives. I'm looking forward to further collaboration with our partners, the new initiatives from APF, adding another link in our bridge, the Kids Helpline, further training of our team, and at this time I would like to formally thank the Alex Panton Foundation for their recent donations to same, the Maples Group with their donation of the APF vehicle to facilitate transportation of our community mental health staff to our at-risk children, and any other NGOs who continue supporting or plan to support in the future our children. We want to improve on our collection of child mental health statistics, our groups in APF, in Alex's Place, and also in the community education, and continued collaboration with all other community services on island and in the ministry. A strong community engagement leads to more supported youth, and hence resilient, functioning adults who have been allowed to reach their full potential. And to our children and adolescents, we see you. This picture that we put here serves as a reminder that despite the severity of any rainstorm, making it difficult for you to see a way through or out of it, there is always a rainbow somewhere on that horizon. Thank you.